We are gathered here at the Georgia State Capitol, which is an annual event for the National Council of Negro Women. We want to meet with our representatives, with our congressmen, and we want to make certain that they are aware of the concerns of the National Council of Negro Women.
Black moms are dying at a disproportionate rate just to have a baby. It's supposed to be the most joyful, the most momentous occasion in our lives, but yet we're going into delivery fearful, not knowing if we're going to make it out of the hospital. That is a problem.
84% of U.S. maternal deaths are preventable. 84%. We're not talking about a young woman who had a heart condition, or had high blood pressure, or had some birth defects with her heart that made it impossible for her to give birth. She was perfectly healthy. I'm telling you, the child ran marathons. She should not have died.
Health equity is one of our major platforms. We have several, but health equity is by far one of the ones that is foremost important to NCNW.
Health equity means to me to get the proper help you need for grief. Therapy is needed for the entity of the human. It helps you understand where you've been, where you are, and where you're going.
Health equity to me means, as a Black woman, as a Black nurse, a Black mom, ensuring that all of our community receives the health care that they deserve, that they need. If we're going into doctor's offices, are we getting the same care as our counterparts? If we're getting admitted for surgery, are we getting that same care? It is important that every community, every race receives that equitable care.
If you don't have a certain economic status, then you're unfortunately at higher risk to not receiving the best maternal care, and that is something that needs to be addressed across the state levels, local levels, and the national levels.
I did not know before Kira died that we as Black women, which is why I'm here this week, are 3 to 4 times more likely to die in childbirth than men. But I didn't know that. And if I didn't know that, that meant thousands and hundreds of thousands of women didn't know.
Social media is a great way to get health information out to the masses. We use it for everything else. It is a great way to get that information out.
Just as we're doing now at the Capitol, emphasizing on the things that Black women deal with on a daily basis.
We are doing forums. We are going in the community. We are educating our sections to make them aware of mental health and prenatal health and all of those kinds of things that were spoken of earlier. Our families, our communities don't know anything about it. So it is our responsibility to reach the masses and make certain that they are educated, they know about what is going on when it comes to health and health education and wellness of women.
Finally, last May, the Department of Health and Human Services opened an investigation into Cedars-Sinai. Why is this important? It's huge. It's never been done ever in the history of the country. Never. What that means is that they have then got to speak to outcomes. Yes. Right? They've got to show outcomes. And it will be tied to their federal funding. That's right. That's how you get their attention. That's how change happens in this country.
So much is going unnoticed with women and their health issues. So it's important for us to have a seat at the table.